So as Fiona said, welcome to our GP-led talk about hypertension, and Dr. Claire Oliver is going to talk to you a little bit about that in a second. The main purpose of this meeting this evening is to explain a little bit more about the health risks associated with high blood pressure, and also to talk to you about the support that's available so you can make the lifestyle changes that will help reduce your blood pressure and manage those risks. So Dr. Oliver is going to talk more about what high blood pressure actually is and the associated health risks and the causes, plus those lifestyle factors that lower blood pressure. And then we will talk more about how you can do that, what support is available. So there'll be sort of two sections, and there will be the opportunity to ask questions at the end. But as Fiona said, if you can put your questions in the chat as we're going through the presentation, then we make sure that we don't miss anything. And we will keep checking on that, or should I say, Fiona's going to keep checking on the chat for us. So I'll hand over to Dr. Oliver.
Hello, I'm Claire Oliver. I'm one of the GPs at Dyneley House in Skipton, where I'm also the cardiovascular lead, and hypertension is one of the areas that I look after. Can everybody see the PowerPoint slide? A nod of the head from the one person who has their camera on would be great. Yes, thank you. Next, thank you. Next slide, Fiona, please. So hypertension, what is it? Well, it's the medical term for high blood pressure. And what is high blood pressure? So it's raised pressure in the arteries that take blood from the heart. So when the heart pumps out blood, and that's taken by arteries to the organs around the body, and then it's returned to the heart. So if your blood pressure in your arteries is raised, over time, that causes damage to those blood vessels. They get inflamed, they try and repair, they lay down fat, they lose their ability to be so elastic, so they get stiffer and they get narrower. And that makes it harder for the heart. You know, if you're trying to pump something out against a blockage, it's harder. So it makes it harder for the heart to pump blood around the body. And over time, you know, there are consequences to that. It's incredibly common. Affects 1 in 4 adults, but actually not all of those are diagnosed. There's a lot of people out there who have high blood pressure, but who don't know about it. Next slide, please, Fiona.
Sorry.
Sorry. No. Oh yeah, that's right. So we talk about it in terms of numbers. You know, people talk about 120 over 80 or 140 over 90. So those two numbers, one of them is higher, that's the top number, that's called your systolic, and then the one underneath is called your diastolic, and that's a lower number. And all that means is it's the pressure or the force created when the heart pumps blood out of the body, and then when the heart is relaxed in between pumps. That's what those two readings mean, and that's what we measure when we measure your blood pressure. And so when you come into the surgery, we want your blood pressure to be 140 over 90 or lower. So those two numbers. But actually we're moving more and more towards home blood pressure readings, because we know when people come into the surgery, their blood pressure usually goes up a bit, which is why we allow it in the surgery to be up a little bit. But when you're at home and you're relaxed, it's generally a bit lower. I mean, I think sometimes people think that your blood pressure reading should be the same all the time. But in any normal person, if you're stressed, if you're running for a bus, if you do some exercise, your blood pressure goes up. If you're asleep in bed at night, your blood pressure goes down. That's normal, and which is why as well, if you've got high blood pressure, you often find that when we do your yearly review, we'll ask you to do a week of readings at home, and we can average those out, because we know that your blood pressure goes up and down throughout the course of the day. So the worrying thing about hypertension and why it's called the silent killer is that people don't generally know that they've got high blood pressure. I think, you know, we often get called into the surgery, people saying, oh, I felt a bit dizzy this morning and I measured my blood pressure and it was a bit up. And generally that's not a sign of high blood pressure unless it's incredibly high. So that's why, you know, everyone over the age of 40, we always ask them to give us a blood pressure reading every 5 years. Because unfortunately, you know, generally people don't know if their blood pressure is raised. So why does it matter? It doesn't make you feel poorly generally. So it's a problem with what's happening in the background, you know, over time if your blood pressure is raised and not treated over time, because it's a major risk factor for what we call cardiovascular disease. It's not the only risk factor. There are lots of other ones, but it's a major risk factor. And cardiovascular disease is a disease of the blood vessels. So it's, and the result of that is strokes, mini strokes, TIAs, heart attacks, heart failure, kidney disease, the type of dementia called vascular dementia, which is due to damage to the blood vessels, as opposed to Alzheimer's dementia, which is a different cause for that. And it can damage the small blood vessels of the eyes. So, you know, it's important to treat it. So why should we treat it? So there's been lots of studies on hypertension, because lots of people have hypertension. So they looked at, you know, if you lowered someone's top number, the systolic number, the higher number, by 10, say yours is 150 and they reduce it to 140, it reduced people's chances of having any kind of event, heart attack, stroke, by 20%. It decreased your chance of developing heart failure by 40%. You know, that's just under half. A stroke by 35% and a heart attack by 20%. So, you know, it's really important to treat. So what causes it? Well, there are some things we can't change. And, you know, those are things that, you know, you're born with. So you can't change having a family history. There's certainly a genetic component. You can't stop getting older. You can't stop being of African or Caribbean descent. But actually, there are lots of things that we call modifiable risk factors. So things that actually you can change. And that's, you know, unfortunately, all the hard things to change. So, you know, being overweight, having too much salt in your diet, not having a diet rich in fruit and vegetables, drinking a lot of alcohol. You know, a glass or two of red wine a week is fine, but drinking over the recommended limit of alcohol, and not exercising. So I'll move a bit onto treatment now, and how we treat high blood pressure depends on how high it is. I suppose that, you know, that goes without saying. So there's stage 1, 2, and 3, and how we treat it, particularly in stage 1, you know, that's where lifestyle particularly comes in. And, you know, stage 1 is where your blood pressure is between 140 over 90 and 159 over 99. Take 5 off each number if you've done it at home. So, and this is if you're under 80. The measurements are a bit higher if you're over 80. So if you're a someone who's got newly diagnosed hypertension, we will always offer you as the first line, ask you if you want to if you can make lifestyle changes, because if you are otherwise fit and well, and I'll talk about that in a second, and your blood pressure is just raised, and you say, well, you know, I know I need to lose a stone, and, you know, significantly cut down my alcohol, start doing some exercise, then often we will say, okay, we'll do lifestyle measures first, and then we'll review it again in 3-6 months. And, you know, people do make significant changes. It's hard, and it's hard to stick to, you know. There are some people who at stage 1 will always want medication, and that's fine. And there's some people who we will always offer medication to at stage 1, in addition to lifestyle. Oh, just a bit of information about, again, studies that's shown what people can achieve by making lifestyle changes. So if you were to lose 5 kilos, which is almost a stone, I think, near enough, then you're dropping blood pressure, the top number, on average would be 4. You know, these are not perfect studies, and every person is different in how they will respond. If you cut your salt intake by a teaspoon a day, so you're allowed just under a teaspoon a day, but if you're having 2 teaspoons a day, and most of that is in processed food, you could drop it by 4. Exercise, 2 to 3, and a Mediterranean diet, you know, over a long period of time, by 3. So there's evidence that shows that, you know, you can, if you make changes, you can lower your blood pressure, which is why we always suggest that, you know, as first line. And particularly in the early days, it may delay the need for you to take blood pressure tablets. Now, if you have other problems, if you're diabetic, if you've already got kidney damage, if you've got raised cholesterol and what we call a raised cardiovascular risk, or you've already had a stroke or a heart attack, you'll always be offered medication. Lifestyle too, but in that situation, you would always be offered medication too. And by the time you get to stages 2 and 3, which is again is that much higher blood pressure, lifestyle still is important and will always help lower your blood pressure, but you'll automatically also be offered medication. Next slide, please. I'm not really going to go into this very much because, you know, I could talk forever about this, but the main medications people are offered will be calcium channel blockers like amlodipine, and they relax the muscles of the blood vessels, you know, to kind of make it easier for the heart to pump. A lot of people take what we call ACE inhibitors like ramipril, and they're good for if you're diabetic or if you've got kidney problems. Or sometimes people will be offered diuretics, which help you lose fluid, such as indapamide or benzoflumethiazide. And most people tend to be on 1 or 2. Well, actually, over the course of a lifetime of hypertension, most people will end up on 2 medications. Some people, I think, and I've heard this, people have said this to me on several occasions, that they think that they're on medication and their blood pressure is normal, so they stop taking their medication because they think, actually, well, my blood pressure is back to normal now. But it, you know, blood pressure medication, lifestyle changes, you know, it's your friend for life now, really. Unless, you know, we see people who've had gastric bans and bypasses who can stop all their medication, can stop being diabetic. So, you know, there's no doubt that significant lifestyle changes can help. So it's, as I say, it's lifelong care. You'll have yearly reviews, and what we're doing there is making sure that your blood pressure is controlled, but also controlling all those other things that can cause cardiovascular disease. So we'll always check your kidneys. We'll always check you haven't developed diabetes. Always check your cholesterol. Check there's not other things we can also be treating to help lower your risk of having or developing cardiovascular disease. And we'll always talk to you every year about lifestyle changes. So just, yeah, kind of things to remember. It's important. It's a major risk factor for cardiovascular disease. It usually doesn't come with any symptoms. Reduces your blood pressure, reduces the risk, and we'll always keep trying to reduce any other risk factors that you might have. And how important lifestyle changes are. And, you know, kind of my philosophy is any change is better than no change. Thank you.
Thank you, Dr. Oliver. I'm going to stop sharing this presentation now and move to Anna and Cerin.
Thanks, Fiona.
That worked? So.
It did work. So we will start to share a different presentation now. So yes, thank you, Dr. Oliver. Very useful to know that reducing your blood pressure can actually reduce your risk of cardiovascular disease. And it doesn't matter when you start to make those lifestyle changes, it can make a difference. And small changes, that's definitely a philosophy of ours. Doing something is better than doing nothing. That's the good news. So before I witter on too much more, who are we? Yeah, Cerin and I are Move, Be Happy. I've got massive feedback on this now. Eat, Move, Be Happy. And we are a local social enterprise organisation that helps people improve their lifestyle. So I'm Anna, not Cerin. This is Cerin, not Anna. Hello, everybody. And broadly speaking, we help people eat better, move a bit more, and usually that means they're healthier. We know that eating better and moving more, exercising, helps us manage those health risks. We provide one-to-one or group coaching for people, and we've got a number of different groups and classes within the Skipton area and the Ilkley area throughout waca. So we're going to talk to you a little bit about the biggest and best lifestyle boosts that you can make to lower your blood pressure. And you've probably heard a lot of this before. Lifestyle change can feel quite daunting. It can feel like it's a mammoth undertaking. And we speak to lots of people, we meet lots of people who think that they can't make those changes. But actually, we're here to tell you that you can. And the three most important changes are that balanced diet that Dr. Oliver alluded to, regular exercise. That doesn't mean you have to go to a gym. There are lots of different forms of exercise, unless you want to go to a gym, of course, and live at a healthy weight. Now, that will be very different for different people, and that's okay. And as I say, you probably already know these things and know that they're good for you, whether it's to reduce your blood pressure or to reduce other health risks. But knowing it often isn't enough. Often it's the doing. So the question, the $60 million question, is what's stopping you making those changes that can reduce your blood pressure? So this is where, if you want to, you can start to share some stuff in the chat. We are sharing some of the main barriers that we've come across in the years that we've been coaching people around their healthier lifestyle habits. And the main barriers are listed on the slide. I'm not going to read them all out, but it's around motivation, not knowing where to start. You might think you've tried before, and we hear that, oh, I've failed a lot. We're not going to go through all of these, but we are going to pick out the most common and just talk a little bit around them. And it will be really interesting to hear in the chat, are there any on there that really resonate with you, that you can relate to? Or are there any that we've missed off that you would like us to talk about? Fiona will be keeping an eye on the chat, and we can come back to that as we go through our bit of the presentation or at the end in the question and answers. I'm going to hand over to Cerin, and he's going to talk through some of the barriers.
Hello there. So the first barrier that we often get here is this one here, the no motivation. Phrases we often hear are things like, I just can't be bothered. It's too much effort. It's too much like hard work. We hear these things a lot of the time. It's possible that you may feel some of these things as well. And to be honest, yeah, like I said, this can be a huge factor holding us all back. Motivation, the enthusiasm, the drive to do these things. We often think these are big things. Where do we start? How do we do this? Oh, really? Do I have to do all that? It can stop us from even starting. One thing we found is very useful that can help us with motivation is finding out what is really important to us and finding out why it's important to us. Now, Dr. Claire mentioned before various of the health risks. It is quite possible that you will find in your heart thinking, oh my goodness, I don't want those things to happen to me. I don't want to leave my family in that situation. If we can really identify these factors that are important to us, that is going to help, turbocharge our motivation. Like it says there, if you can discover your personal important reason to do this, your motivation will go through the roof. You will wake up in the morning thinking, right, I want to do this. This is important to me. we've got to identify these things. We've got to find out what they are and remember them. But when we know what they are, they can really drive our motivation. We run a course, a Live Better course, all about healthy eating, lifestyle change. And because we think that this motivation, this drive is so important, the first part of it is all about how to find out your personal, powerful reason to, keep plugging away. Because without motivation, things get very difficult. It's true, that is life. But with it, everything becomes much easier. We're in a group of people, of like-minded people, and they all want to do the same kind of thing. We help each other out. And with that drive, with that motivation, we can move forward and make things better for ourselves. So if you find yourself thinking no motivation or lack of motivation, this thing can help you. We can help you find out the important things for you. Another barrier is some form of, I've tried it before and I've failed. Some variation of, what's the point? It doesn't work for me. I've done all the things the doctor said. I've done all the things the magazines say. I've tried it and it just doesn't work. I can't keep up with it. I can't keep going with it.
We hear a lot about, we've tried this diet or that diet and I lose weight, but then I put it all back on again.
Yo-yo dieting.
Yeah.
A very, very common thing. It is hard. And again, I'm not going to lie to anyone here. It is difficult. It will take practice. But going back to what we were talking about before, just a second ago, the motivation. If we can find out the reason for why we're doing this, difficult things, important things are worth that practice. They are worth that effort. And importantly, if we try things, we will mess up occasionally. That's okay. I know for a fact I have messed up so many times in my life. Shut up. I have messed up so many times in my life, but that's okay. Because wherever possible, I have tried to learn, adapt, and I try again. And we can all do that. Give things a go, mess them up, learn, go again.
I'm going to jump in again. There's for me, it's not about failing. It is about trying. We hear it a lot when people talk about, particularly their eating habits, that they've failed. And this isn't about being perfect. And more importantly, we don't think this is about dieting. It's not about restricting your food. It is about choices. It's not about being hungry all of the time and not being able to eat the things that you want to eat. It is about balancing out the things you want to eat. I'll shut up now.
So, like the bullet point says there, we try things. The second bullet point, genuinely make that first step as ridiculously easy as possible. Again, a common thing, if we find ourselves saying, what's the point? It doesn't work for me. It hasn't worked before. Honestly, make that first step much, much easier. It does not need to be hard as nails. Start easy. You can build up from there. We learn from our own and other people's experiences, and that's when we can start progressing things forward. But genuinely, make the first step, whatever that first step is, make it really easy, embarrassingly easy, and then we move on from there. I think it's the lottery quote there. You've got to be in it to win it. So if you find yourself, I've tried before, what's the point of me even starting? No, give it a go. Try again. We will not succeed unless we give it a go. So give it a go, and then we've got a chance of moving forwards from there.
I think another one of our firm beliefs is exactly what Dr. Oliver has just said, is that doing something, even a small change, is better than no change at all. Better is better. And so it doesn't have to be that huge mammoth task, just nudging yourself as one step in the right direction. And we do have many people who we've coached that when we first meet them think that they can't do it or thought that they couldn't do it, and they really have. And we'll share some of those stories of people at the end.
And again, if you're in this situation, if you've tried it and not succeeded or fallen off the wagon or whatever, leave a comment in the chat. Let us know what was difficult for you. And like I said, we will learn from our own and other people's experiences. Let us know what happened in the chat. And having said that, moving on. Again, another very, very common barrier stopping people. I'm too busy. Again, some variation of I'm too busy. I don't have time right now. I'll do it tomorrow. I'll do it next week. I'll just get this over and done with first, and then I'll do it. And I'll start next time. Okay. Being busy is, yeah, I can't deny it. Life is busy. It's things will get in the way. Things will stop us from doing things right now. But I'm sure you'll figure out yourself. I'm sure you'll discover yourself. Excuse me, I've got a dog just down here. Doing things on the spur of the moment often leads to poor choices. I know the amount of times I have walked into my kitchen, for example, and just thought, what we're going to have? Oh, I don't know. I'll just go for the quickest, easiest, most convenient, instant meal I can think of, just because it's there and I'm busy. Pizza, yeah. Because it's quick and easy and it just does the job. Spur of the moment things often lead to that poor choice. So if we do find ourselves busy, the answer to that problem, it does take a bit of forethought, but yeah, prioritize the important things in your life, put time aside for them, bit of planning ahead so that we do these important things. Going back to the motivation thing we talked about at the start, figuring out the important things in our lives. And so we do put time aside for it. I've got a friend, whatever happens, she puts time aside to watch Traitors on the TV. Whatever happens, it's important, she is there. If we can figure out that our health, the way we live our lives, the way we live with our family and our friends, the things we do with them, if that is important, then yeah, we will put time aside for it. We will put it in our calendar, put it in our diary, or whatever, and we'll say, no, I'm not going to do that other thing because this is important for me. I'm going to do this for me. Bit of planning ahead. I'll be honest though, it's not easy to do that. But again, on the Live Better coaching course we do, there is a whole topic devoted purely to planning ahead and how to minimize the times that we do these on the spur choices, on spur of the moment choices. I'm sorry. We think it's important, and yeah, we help you along that way with that. We help you make these choices. We help you plan ahead. So yeah, you can get the important things done. And again, if you find yourself saying you're too busy or anything like this,
Running out of time, it might be. Yeah, I run out of time to do things.
Yeah.
Because it takes a lot of effort. So and I don't really know what I'm doing. So it's just easier to do what I've always done. That's a version of I'm too busy as well.
If you find that at all, stick in the comment, whatever. We'll get back to them at the end. Is that okay?
Yeah. Great.
And last one then. The last big major one that we often hear is, I don't know where to start. So things like, I hear different stuff every day. I feel overwhelmed. I don't know where to start. The Daily Mail told me this one day, it told me the opposite the other day. Some magazine said something else. This is a superfood, that's a superfood. A lot of complicated and often contradictory stuff just being bombarded at us adds to a lot of confusion. Yeah, confusion, I think, is a word for me. We hear all these different things. We don't know where to start. We don't know what the next step is, and we just get confused and bogged down. And yes, starting anything can be tough. Going back to what we mentioned before, keep it simple. I'll be honest with you, 90% of the stuff that I read in the newspapers about the latest health stuff, the latest superfoods, we can safely ignore all that. It's a lot of noise, a lot of it. Dr. Claire mentioned at the start, just healthy eating, the Mediterranean diet, just that, reduce blood pressure by a number of points. Keep things simple as possible. It will reduce or eliminate so much of this confusion, these contradictory things we're bombarded with all the time. So keep it simple. Again, start as easy and as simple as possible. If it's too difficult, cut it in half. So this starting point, it does not matter where you start. If it's difficult to start, cut it in half. Do half of it. Do a little bit. Just get that momentum moving forwards. Start traveling in a certain direction. The analogy we often use is the stepping stones. We don't have to do one big massive leap all in one go and get it perfect, because I'll be honest, we're none of us going to get it perfect, ever. But if we can make one small step, a simple step, make that part of our lifestyle, just make it, yep, this is the thing I do all the time. Then we can make the second little baby step in the right direction. Make that part of our everyday life. And then when we're ready, move on to the next simple little stepping stone. And again, if any of that resonates, or if you've got any questions or anything, the chat is the place to put it, because I think in a couple of minutes we will start diving into that and see if we can answer them, I think.
We're just going to finish, I'm just going to whiz through the next couple, because we don't necessarily, we said we weren't going to go through all of the potential barriers, but this slide here just shares some of our client stories, some of the things our clients have actually said. This isn't just about losing weight. I know a couple of you have mentioned that you are active. There was somebody who swam, there's somebody who goes to the gym. So it seems that your exercise is fine. It's the support with the losing weight that's more tricky. And that's where we focus very much on the habits to help you maintain some consistency around the healthy choices. And Live Better helps you to do that through the coaching, through the groups. We do combine with exercise. So there is an exercise element to it if you choose to do that. And some of the things for me, some of the things that I'm proudest of actually, is we have people who typically would not have described themselves as somebody who exercises. They've never done it and were actually quite fearful of it. But we've got people who thoroughly enjoy themselves and are actually very surprised at how much they can do and have fun whilst they're doing it. And the next one is just sort of typifies things for me. I know how to eat healthily without being on a diet. I'm not perfect in any way, but I make far better choices. And for me, that helps from the point of view of, this is not something that you stop and start. Somebody before said, oh, you've tried so many times to lose weight. And often, not always, but often when people talk about being on a diet, they think of having to stop doing things or stop eating the things they want to eat. This is not about that, but it is about getting the balance more in your health favor. So one of the ways that one option that you have is to look at some support around helping you change your eating habits. Live Better is one of those ways. There are other courses available within the local area. As far as Eat, Move, Be Happy is concerned, we offer Live Better, which is a 13-week health coaching course, and it is fully funded. And not only do you get the support around your eating habits, but you also get access to our Get Moving exercise classes. And we have different classes aimed at different people. So for beginners or people who are newer to exercise or wouldn't necessarily want to go to a gym. We hear a lot, people don't necessarily want to go to gyms. There are lots of other ways that you can exercise. Get Moving is about building your confidence so that you can go out and find the things that you want to do. And we also run rehabilitation Get Moving classes for people who live with chronic medical conditions or injuries. So if you want more information, then you can find us at www.eatmovebehappy.com or contact us after this presentation.